Hello and welcome to our show, Health and Wellness Save a Life. Life is very precious. The sign of being alive is the continued pumping of your heart. When your heart stops beating, you can get into a cardiac emergency. A medical emergency may occur at any time to anyone. As per the WHO census statistics, mortality due to cardiac causes has overtaken mortality caused by all cancers put together. The concerning change in recent times is that the onset of heart disease is now seen at a very young age, especially in people who are in their 30s and 40s. The biggest reason for heart-related disease is a lack of awareness as to what needs to be done during a cardiac emergency. Every adult should know what conditions qualify as heart-related or medical emergencies, and the best one can do is to learn beforehand the actions required in case of a cardiac emergency. Life-saving techniques such as CPR give you the power to save a life, and it has been proven that bystander CPR improves the rate of survival by almost 15%. It's even more important if you have a loved one who has a history of cardiac disease or heart disease, as research reports that the majority of cardiac arrests occur at home. Save a Life is an initiative through which people will be made aware of the early signs and symptoms to look out for as far as a cardiac arrest is concerned, so that patients can get to a hospital in time and also be trained on giving CPR if the need arises. Today we have with us eminent cardiologists who can help you understand sudden cardiac death and the role of CPR to revive and save a life. Let me begin with Dr. Iranna Hirapur, consultant interventional cardiologist, Gulbarga. This is Gulbarga Heart Foundation in Gulbarga. And we also have Dr. Bhaskara Rao, a consultant interventional cardiologist, Omni Hospitals in Vizag, and Dr. Senthilkumar Nallusamy, Chief Cardiologist, Rana Hospital in Tamil Nadu, and also Dr. T.R. Muralidharan, Interventional Cardiologist and Electrophysiology Professor and Head of Department of Cardiology, Sri Ramachandra Medical College and Research Institute in Chennai. Thank you so much for joining us here on the broadcast. Let me first take my first question to Dr. Hirapur. We've been asking our viewers to send questions via WhatsApp, and here are some of them. This question comes from Ms. Geeta Shankar. She says that she's heard her friends suffer from regurgitation caused by one bacteria causing damage to a heart valve. Can that be true?
Yes, this is absolutely can be true. There is an entity called as rheumatic heart disease and rheumatic fever. There is a bacteria called group A streptococcus, which causes sore throat in the young people. As a sequelae of that, there can be involvement of the joints. Subsequently, few of the unfortunate patients can develop involvement of the heart valves. So if there is an involvement of the heart valve, there can be thickening of the heart valve, hardening of the heart valve, by virtue of which the heart valve will not be able to close properly or open properly. Since the blood will flow in forward direction in our heart, when the heart wall is not able to close properly, there will be reverse flow of the blood from one chamber to the other chamber, which is called as regurgitation of the blood. This rheumatic fever is very common in Indian circumstances, which affects mainly poverty-ridden, overcrowded and poor hygiene people. This is one thing that can cause involvement of the valve by bacteria. There is other entity called as infective endocarditis. If a patient is having a damaged heart valve, there can be, because of the wear and tear over the valve, there can be involvement of this valve with an infection either by a bacteria or by fungus. Yes, definitely, there can be involvement of valves and infection by these bacteria, which leads to catastrophes and bad outcomes in patients with heart disease.
Right. We have another question coming in from a viewer that if someone has high BP, but otherwise has no cardiovascular complication and is generally in good health, are there any precautions to be taken during routine exercise? I'd like to take this question to Dr. Rao.
Yes, actually, all the patients with hypertension should practice regular exercise. Exercise can be of different types, but exercise is one of the important lifestyle practices that prevent and manage cardiovascular diseases and their risk factors. Exercise like dynamic endurance exercise, exemplified by jogging, walking, or swimming, or dynamic resistance exercises like climbing up the stairs, pull-ups, or isometric hand grip exercises. All varieties of exercises have been shown to improve high blood pressure in long term. Now, the reduction of blood pressure can be as great as 8 to 10 millimeters mercury. Now, the second question, whether the patients with systemic hypertension should take precautions while doing exercise. Definitely yes, because systemic hypertension or high BP is one of the important modifiable risk factors for heart attacks and strokes. So naturally, when you do exercise, which is unmonitored, then if the patient develops symptoms like chest pain or breathlessness or chest discomfort, giddiness, such kind of symptoms, you should stop the exercise and definitely go to a medical practitioner and take medical advice. Similarly, try to avoid Valsalva maneuvers. And of course, the blood pressure at the time of exercise is 160 or more, or diastolic blood pressure 100 or more. They should avoid exercise at that time, get the blood pressure controlled by medications, and of course, continue exercise. So these are the important, precautions that should be taken by a patient with high blood pressure while doing exercise. And of course, recommended exercise durations are about 30 minutes a day, at least 5 days in a week. And also a couple of sessions in a week of isometric exercise can be beneficial.
Right. Let me take my next question to Dr. Senthilkumar. This question has come in from Sri Ganganagar by Pratap Singh, asking that if a person feels a slight burning sensation in the chest while walking, that is taken to be an indication of a heart problem. But if the feeling gradually subsides, say over the course of a month or so, is that okay, doctor?
There are three things which need to be addressed through this question. Very important question. In general, all chest pains are not due to heart. It can be due to ulcer, it can be due to muscle, or it can be due to bone. This is point number one. Point number two is, the question is very clear. The person develops a chest pain on exertion, on walking, on climbing stairs. Definitely, this should be addressed. This may be due to a heart problem. Third thing is, the medical terminology for this effort-related chest discomfort is called as effort angina. This should be the person is having a pre-heart attack stage. This effort angina, the term is called as pre-heart attack stage. So, most important is, this should not be, this complaint, this chest pain on walking should not be neglected. He or she should consult the treating doctor or a cardiologist at the earliest to prevent a heart attack. The message is, if a person has an effort angina, that is chest discomfort on walking or on climbing stairs, if the cardiologist advises for an angiogram to see for any blocks in the arteries going to the heart, he or she should undergo the procedure to see for any blocks in the arteries going to the heart.
Right. Well, what is coronary artery disease? Can coronary artery disease lead to sudden cardiac arrest? Dr. Muralidharan.
Yes, very important question. It's a continuation to what Dr. Senthilkumar said. The coronary arteries are the tiny blood vessels that supply blood to the heart itself. To understand, though heart is the organ that pumps blood to the entire body, the heart itself needs blood for its survival. So when it is pumping out, fine blood vessels will start from the beginning of the aorta, that's the main vessel carrying blood to the entire body. So this vessel will be supplying to the heart muscle. There are typically two coronary arteries. One is the right coronary artery, other is the left coronary artery. The left coronary artery will divide into two branches, the anterior descending artery and the circumflex artery. To understand, for a heart, there is a major artery supplying the front portion. One goes on the right side and one goes on the left side to the back side of the heart, to make it simple. These arteries are like a main roads, can give to several divisions, like a by-lanes or side roads, and they supply to the entire heart muscle, by which heart gets oxygen or nutrients, so that it is able to pump blood to the entire body. A block there is the one that causes the heart attack, or angina, or ischemic heart disease. Different names are there, but the basic problem is blockage the blood supply to the cardiac muscle due to block in one of these vessels or branch of these vessels. A block there, if it is severe enough, can cause cardiac arrest. The second part of the question. So a massive heart attack or a severe ischemia can lead to a sudden cardiac arrest, which can be fatal at times if we don't treat it. So to put it in a nutshell, coronary arteries are the arteries that supply heart muscle. Blockage of that causes ischemia and ischemic heart disease.
Right. So how long does it take for coronary artery disease to develop, and what are the causes? Dr. Hirapur.
We all saw coronary artery disease can, in Indian circumstances, can occur at a very early age. We did see so many actors dying because of heart attacks, like Punit Rajkumar, Chiranjeevi, Siddharth Shukla, the celebrities. In Indian circumstances, the development of the coronary plaques, that is the blockage in the blood vessels supplying the heart vessels, appears much earlier compared to the Western population because of our poor dietary habits, excessive smoking, lack of exercise, increased incidence of diabetes, increased incidence of hypertension, and overweight. So these occurrence of the plaque can occur as early as first to second decade. But with the bad habits like the risk factors what I alluded, there can be progression of the plaque and there can be rupture of the plaque. A small plaque can also rupture and lead to sudden cardiac deaths. So in order to prevent that, we need to maintain a good, healthy lifestyle so that the formation of the coronary plaques and its progression can be stopped at the earliest so that young heart attacks can be prevented.
Right. So with that, we're stepping into a very short break. We'll be back with a whole lot more on the other side. Do stay tuned to our show, Health and Wellness, Save a Life. Welcome back to our show, Health and Wellness, Save a Life. We're talking about heart health. Let's find out, does heart failure mean immediate death? And can heart failure occur without knowing it? Dr. Rao.
Yeah, nice question. Because, most of the times we heart attacks, that is coronary heart disease. Heart failure is a condition which is one of the most common causes of hospital admissions. And as you rightly said, it is associated with a very high rate of loss of life. That is, mortality is very high. In fact, the 5-year incidence of loss of life can be as great as 70% or more in some of these cases. But yes, the last 2-3 decades has seen great advancements with the discoveries of newer drugs and newer devices which can be used in the patients with heart failure, and they have clearly prolonged the quality of life and also the duration of the life also. So that is the loss of life has also come down with these kind of device therapies like CRTD and ICD and also newer drugs. So what is heart failure? So heart failure basically is due to an abnormal function of the muscles of the heart, which doesn't allow the heart to pump blood adequate to the requirements of the body tissues. And also there may be increased pressures in the chambers of the heart. So definitely heart failure is a condition which has high death rates, but the last 2-3 decades I said that developments, newer drugs have improved the outcome. But the second question is that can they be asymptomatic? They can have very non-specific symptoms like mild breathlessness or general weakness, palpitations. But some of the conditions which are associated with heart failure should be kept in mind, like patients with heart attacks, patients with valvular heart disease due to rheumatic heart disease, which was earlier described, and also patients with high blood pressure, diabetes mellitus, and some of the young ladies with pregnancy. So they are all prone to develop heart failure. So these are the patients who should get regular checkups done, look at the heart function so that they can take proper precautions. And at this instance, I would like to point out that one of the most common causes of heart failure with reduced heart function is heart attacks. So, the earlier we notice and treat heart attacks, the less will be the incidence of heart failure, which is always associated with sudden cardiac death and a high mortality.
Right. Let me also take my next question to Dr. Senthilkumar. How does heart failure cause a sudden cardiac death? Can we prevent it? Dr. Senthilkumar.
As Dr. Rao had highlighted, basically a heart failure patient has a reduced pumping capacity of the heart. When there is a reduced pumping capacity of the heart, that patient is prone for developing an erratic heart rhythm, what is called as an arrhythmia. So the point number one is this erratic heart rhythm can cause a sudden cardiac death. This is point number one. Point number two is all heart failure patients will not have an erratic heart rhythm and will not have a cardiac arrest. So which patients are prone for developing a cardiac arrest? Patient needs to be assessed. There is a simple test where you do a 24-hour ECG monitoring, which is called as Holter monitoring, and find out whether that person, he or she, is prone for developing a rhythm problem, which can cause a subsequent cardiac arrest. Third thing is coming to a second part of the question, whether this sudden cardiac arrest can be prevented. If he or she has been found that she is prone for developing this erratic heart rhythm, there are several medicines and there are high-end pacemakers like ICD, which can detect this erratic heart rhythm and give us shock from inside the body itself and prevent this cardiac arrest happening, and the erratic heart rhythm can be normalized to the regular heart rhythm.
Right. Let me take my next question to Dr. Muralidharan. CPR can save a life, but how would a lay person know if he or she is doing the CPR with the right technique? What kind of results can one expect from CPR and in how much time, Doctor?
Okay. See, the CPR part, it's a very, very important thing. In fact, more lives can be saved if we disseminate this information, like what we call cardiopulmonary resuscitation, wherein the rescuer, he can be a medical person or even a lay person. In fact, we want the knowledge should go to every person who knows, who are educated, who are uneducated. Anyone can get the training easily. You compress the chest. Usually the typical breastbone, the lower half, they have to make a compression at a speed of 100 times per minute. Intermittently, or every 30 compression, they give a mouth-to-mouth breathing 2 times. These are standard things. But what I would like to stress is, when you are a person to give an effective CPR, a little amount of training is needed, and the little amount of training can be imparted to anybody. Anybody within a few hours, we can train them. The training opportunities are available across several hospitals, and now in India, the number of people who can do CPR is increasing. But we need to go a long way. A lot of people should learn, because even a well-developed country like United States, the number of people who can be rescued out of hospital when they get a cardiac arrest by CPR is around 10 to 15% only. So we need to fight this major thing. But once we do, in a timely CPR, effective CPR, which can be easily acquired by a simple training, can save a lot of lives in that way. And how long to continue is a good question, where you continue as long as the medical team arrives. So commonly when we say CPR, activate the emergency system. In our country, like Tamil Nadu, where 108 ambulance are going for the nearest hospital, calling for an emergency service, even police or fire can come for rescue with the medical team. But during this time, the continuous cardiopulmonary resuscitation in the form of compression of the chest with mouth-to-mouth breathing intermittently at a ratio of 30 times compression and 2 times mouth-to-mouth breathing is a recommended one, can be done. So what is needed is knowledge of CPR, able to give it till the medical support arrives at the site of it. We can save lives in time.
Right. So lack of CPR awareness is a big health challenge in India. Please tell our viewers, why is it essential for people to learn CPR? Dr. Hirapur, if you could take that question.
CPR gives a cardiac arrest victim better chances of survival. As previous speaker told, the incidence of sudden cardiac arrest or death is around 10%. And the survival rate in Western population is around 10 to 15%, whereas we don't have a proper study in India. It is approximately around 1 to 5%. CPR needs to be known by everyone. For example, the police personnel, the ambulance drivers, security guards, people who are working in gym, especially we are seeing a lot of deaths in the gym, people like swimming trainers. CPR should be made a mandatory guidelines in the curriculum of the education system between 10th to 12th standard. So what happens when there is a cardiac arrest? There can be heart can just fibrillate without effective contraction. So we need to maintain blood pressure to the organs, specifically to the brain. If the brain gets deprived of blood pressure, the brain dead cell die within 5 minutes. So this CPR by a layperson till a dedicated medical team arrives at the scene should be continued, so that even though the heart may survive later, the other organs may function, but the brain will be dead. So that's the reason CPR should be known by everyone, and everyone should learn CPR so that we can prevent possible catastrophes which is happening in front of us.
Right. Let me take my last question now to Dr. Rao. Doctor, can a person recover from heart disease? What about one's lifespan? How does that get impacted? Dr. Rao.
Definitely, yes. Any patient who gets a heart attack, what we call as an acute myocardial infarction, we have very good treatment modalities to rescue him and also improve mortality as well as improve the quality of life to near normal life patterns. But a very important information is that when we suspect heart attacks, we need to approach tertiary care center as early as possible. Generally, we call that particular critical time as golden hour in our medical circles, because a heart attack means there is a continuous damage to the cardiac muscle. Unlike other cells like skin or other tissues, once a cardiac muscle cell gets permanently damaged, there is no regeneration. That leads to what we discussed earlier, heart failure. So the whole idea of management of heart attacks is to prevent permanent damage to the cardiac muscle and prevent sudden cardiac deaths and improve long-term mortality. That's very important. That's why it is essential that the patient with a suspected heart attack should approach definitive treatment methods as early as possible, preferably within the first 1 hour. That's the important thing. The second thing is to prevent further heart attacks, which we call it as secondary prevention. So proper medication regularly, getting regular checkups, and also managing their coronary risk factors like high blood pressure, tobacco usage, and of course diabetes mellitus, high blood cholesterol levels, stress levels, all these things, eating fresh fruits and vegetables, reducing the psychosocial stress, that would prevent further heart attacks. Okay, so that is the best. Also, I think even before a heart attack comes, we need to prevent these heart attacks by properly managing our existing coronary heart disease risk factors. And I would say that the prevention of heart problems should begin very early in your life, as early as in childhood. So, basically grow them up with good habits, lifestyle habits like, regular exercise and good diet, healthy diet.
Right.
So that way we can
I'm afraid we're totally out of time, Dr. Rao, Dr. Hirapur, Dr. Muralidharan and Dr. Senthilkumar. Thank you for joining us on our show, Health and Wellness Save a Life. With that, we're saving a short break. Lots more coming up on the other side.